Hi, welcome back to Health Score. Today we're in your numbers section and we're finishing up this section and all of Health Score with GGT. GGT or gamma glutamyl transferase. Recommendation: men, keep your level below 51 units per liter. Women, keep it below 34 units per liter. This is based on a large clinical study, and there was a significant increased risk in premature death when GGT is elevated. GGT, or gamma glutamyl transferase, is an enzyme that traditionally is used to detect liver injury from alcohol. However, there are GGT receptors throughout the body, and it's increasingly understood that GGT is a marker of oxidative stress, in addition to its being a marker of liver injury. Oxidative stress is a concept we return to multiple times throughout Health Score. Whenever the body is doing its normal job of metabolism, it creates free radicals, oxygens that are missing electrons, which are highly damaging, increased risk of cancer and heart disease, and are generally implicated in many processes of aging and onset and progression of chronic diseases. So it's always good to have low oxidative stress in the body, and GGT, like CRP, is a measure of the level of oxidative stress. So it's a very good broad marker for health. Particularly, it's implicated in increased risk of death from all causes, but it's also specifically related to development of insulin resistance and progression and death from diabetes, as well as its known role in monitoring liver disease. So how exactly do you lower GGT? There is nothing new here. There are only the recommendations that we've discussed previously, but you can see that tobacco and alcohol are rearing their ugly head again because they are both pro-inflammatory, and limiting their use reduces general inflammation and oxidative stress on the body, in addition to lowering GGT. So the recommendation is to completely eliminate tobacco use, to limit alcohol to not more than 7 servings per week. Coffee and green tea have been shown to reduce GGT levels. Coffee and green tea or coffee at least, is the number one source of antioxidants in the American diet. And that's not necessarily a good thing. It means that Americans are just not eating fruits and vegetables. But be that as it may, coffee and green tea are recommended for their antioxidant capacity. Coffee recommended a dose of 3 to 5 servings per day. Green tea, 5 to 7. I would recommend one or the other, or a combination of the two. And finally, as we saw with CRP, fat or adipose is pro-inflammatory. So maintaining a healthy body weight, or in particular a body mass index below 25, is important for overall health and reducing GGT. So we've discussed keeping gamma glutamyl transferase below 51 in men, below 34 in women. We discussed the health risks of an elevated GGT. We talked about how to lower GGT, being free of tobacco, limiting alcohol, consuming the recommended amounts of coffee and green tea, and maintaining a healthy body weight. Hope this video has been helpful. If your GGT is normal, it could be an indication that you're meeting those recommendations we've discussed previously. If not, it's a sign that you should go back to those sections, intensify your efforts in those categories to confer an optimal health benefit for you. Thank you very much for your time, and I hope you have a great day.